Hello everyone. I'll be discussing about dermoscopy of pigmentary dermatosis in dark skin individuals. Introduction. Pigmentary disorders carry a tremendous psychosocial impact on patients mainly because of cosmetic reasons. There is a wide range of pigmentary dermatosis that are examined daily in clinical practice and they look alike, making a diagnostic delay. Most common conditions include lichen planus pigmentosis, erythema dyschromicum perstans, and less common are acanthus nigricans and frictional melanosis. Confluent reticulated papillomatosis, dermatitis neglecta, and terraforma formae dermatosis are seen uncommonly. Dermoscopy is useful in differentiating all these conditions. So these are the few examples of a dirty looking dermatosis which present with hyperkeratotic and hyperpigmented papules and plaques, and few more examples of facial pigmentation which present with localized or diffuse pigmentation on the face. So I'll be discussing all these cases and how this dermoscopy helps us to differentiate all these look-alike conditions in clinical practice. So case number 1, this man presented with non-itchy hyperpigmented papules and plaques on upper back and upper chest and upper arms since 6 months. And dermoscopy revealed ridges and fissures. Pigment globules were present on the ridge in a cobblestone pattern and perifollicular scales were present. Hair changes included V hair, that is 2 hairs presenting coming through a single follicular opening, and broken hairs were also seen. Few white hairs were also seen. So this is a close-up view to show cobblestone pattern of pigment globules on the ridge. So this was a case of confluent reticulated papillomatosis. Another example of CRP, it showed fissures and ridges with pigment globules on the ridge in a crocodile skin-like pattern, and this type of pattern is particularly seen in skin of color, and it's because of heavy acanthosis and heavy melanin in the epidermis. So second example, this lady presented with non-itchy hyperpigmented patches on the anterior neck. There is a history of trauma and tenderness at the site of involvement. So dermoscopy showed brown globules which were in irregular distribution with sharp borders and everted edges. Scales can also be seen occasionally. So this is a close-up view to show brown globules with everted edges. So this was a case of dermatitis neglecta. We did a soap water swab test and which resulted in disappearance of the lesion. Dermoscopy also showed disappearance of the pigment globules. Third case, this man presented with non-itchy hyperpigmented papules on both the legs since 3 months. So dermoscopy revealed brown globules which were in irregular distribution, and shape was oval and with round borders, and scales are commonly seen on the entire pigmented globules as well as at the periphery. So this was a case of terraforme dermatosis. So another example with the TFFD, man presented with non-itchy hyperpigmented papules on the trunk since 4 months. So dermoscopy revealed brown globules which were in regular distribution. Globules were oval in shape with round borders, and this particular image showed black dots, and also scales are seen in this image. So this is a close-up view to show black dots. So we did alcohol swab test resulting in disappearance of the lesion, and dermoscopy also revealed disappearance of pigment globules. So we analyzed all these conditions dermoscopically to note the differences. So scales were prominently seen in CRP. Follicular changes as well as sulci and gyra were only seen in CRP, and none other case showed these changes. Black dots were exclusively present in TFFD, and color of the pigment globules varied from brown, yellow, and black. Brown was seen in CRP, yellow was in TFFD, and pigment globules of DN was black. So this is because of in CRP brown color is because of acanthosis and pigment in the epidermis, and TFFD yellow color is because of serous discharge, and DN black color is due to stacking of stratum corneum and debris. So these color variation was statistically significant. Hence dermoscopy can be utilized to differentiate CRP, TFFD and DN very easily. So moving on to facial pigment pigmented dermatosis. This man presented with non-itchy hyperpigmented patches on the forehead since 4 months. Dermoscopy revealed sulci and gyri, which is also called as ridge and furrow pattern. There were black globules and dots, and particularly alternate white and brown lines were present in the cerebriform pattern, and there were no hair changes seen in this image. So this was a case of acanthosis nigricans. So second case of facial pigmentation, this lady presented with non-itchy hyperpigmented patches on entire face since 3 months. So dermoscopy revealed brown and blue-gray dots which were in unspecific patterns. Pigment dots were also present in the skin lines, and the background was erythematous. So this was a case of erythema dyschromicum perstans. So 12-year-old boy presented with itchy hyperpigmented patches on the face since 1 month. Dermoscopy revealed brown and blue-gray pigment dots and globules which were in a perifollicular and periacrine position, and there was a sparing of skin lines, and background was brownish in nature. This is a close-up view to show the pigment globules around the acrine and follicular opening. So this was a case of lichen planus pigmentosis. Lichen planus pigmentosis and erythema dyschromicum perstans look alike clinically, whereas dermoscopy shows subtle changes. Pigment globules are unspecific in EDP, whereas they follow a particular pattern in LPP, and background is brown in LPP, whereas it is erythematous in EDP, and sparing of skin lines is seen in LPP, whereas skin lines are involved in EDP. So last case of the session is a man presented with non-itchy hyperpigmented patches on the forehead. There was a definite history of friction. So dermoscopy revealed brown and blue-gray pigment globules. Perifollicular distribution of pigment globules followed a passion, that is annular or arcuate passion. So there was a distorted pigment network. Follicular plugging was also seen, and along with broken hairs, and hairs were directed towards the force of the friction. One can see in the close-up view that there is a follicular plugging and hairs are directed towards the friction of the force. So this was a case of frictional melanosis. So dermoscopic differentiation of all these conditions was very easy. So sulci gyri was present in AN, and scales were exclusively present in FM, and white hairs in the form of lines, white lines, was present in acanthosis nigricans, whereas follicular changes were particularly seen in FM, and color of the pigment globules was black in AN because it's only epidermal changes. So whereas EDP, LPP and FM, they involve a little bit of dermis also, hence color of the pigment was black along with blue and gray. So variation from skin phototypes 1, 2, 3. In CRP, crocodile skin-like pattern is seen, whereas it is not seen in skin phototypes 1, 2, 3. And dermatitis neglecta and TFFD, there is no differences between all the skin phototypes. Acanthosis nigricans shows black dots in skin of color, whereas in skin phototypes 1, 2, 3, dotted vessels can be seen. And EDP, LPP and FM, there is a pronounced pigment globules are seen in skin of color. So to conclude, dermoscopy demonstrates definitive features in each pigmentary dermatosis. It picks specific pattern in a given lesion which could be missed in clinical examination. Although differences are subtle to analyze, one can master art of dermoscopy with practice and experience. Hence, dermoscopy proves to be a good diagnostic adjunctive in pigmentary dermatosis. Variations in the dermoscopic features in different skin phototypes should be known.